Hey, Cam followers. So we are very lucky today. I know I say this a lot, but no, this time, very, very lucky to have this dude with us tonight. So please meet Dr. James Guthrie. He works at Fitzpatrick Referrals. He is a specialist in orthopedic surgery, but he's also a specialist in rehab, and that's really quite rare to find. We do have the lovely David Dykes who comes to visit us, who has similar qualifications, but this is a big deal. So what is going to be fantastic about tonight is that we've got a surgeon's opinion on elbows, but we've also got a more conservative rehabilitative approach, which is really, really rare. So you're going to love tonight. First of all, I'm just doing a quick shout out. We have the Big Walk is running. This is 30 days of bespoke education, enthusiasm, motivation, inspiration, all on a private Facebook page, and you get emails every single day. I can't tell you how much work has gone into this. And it is running now for the whole of the month of September, which is the International Veterinary Association of Pain Management's Pain Awareness Month. So it's a big deal this September. And finally, before we start, we have this little beauty is back in stock. Yes. So the children's book, Raising Awareness About How Dogs Express Pain, and I feel is an essential purchase for any dog that lives in a family with children and has any form of pain condition. To be honest, any family that has a dog. It's a brilliant, brilliant book. I did write it, so I'm a bit biased. But it's now back in stock. It's $8.99 and all proceeds go to CAM to keep us going. So please do head over to the shop. I'm sure a Canbassador will put the links for us. So please, James, tell us a bit about ourselves. We're going to be like, oh my God, you're amazing.
I'm not so sure about that, but yeah, thank you very much for having me on. It's a pleasure to be here to chat with you and to our audience as well. So I hope everybody is able to pick up a few little pointers, maybe learn a few little things and have some fun. So yeah, you kind of introduced, I'm James. I work at Fitzpatrick Referrals and I am a specialist in, I guess, sort of two areas that I think are really complementary. So that's small animal surgery, so dogs and cats, and I specialize in sort of orthopedics. Also then a specialist in canine sports medicine and rehabilitation. And I think probably calling it sports medicine makes it sound cool, but I'd probably say it's better to describe it as exercise medicine. So it's really anything that affects a dog's or cat's ability to exercise. So that will be something that's going to be quite crucial for osteoarthritis and for elbow joints. And dogs who have problems with their elbows are probably the most common thing that I see, seeing multiple dogs every week or every day. So it's a really big subject. It's a really complex subject. And yeah, I think we can kind of delve into things this evening.
So when you did your rehab, you're a surgeon first.
Yeah.
Did you get challenged when you started going into the more rehabilitative approach? Did it kind of challenge you mentally as a surgeon of to cut or not to cut, and how did you cope with the change in mindset?
Yeah, so I think there are, I suppose, traditionally you could say there's almost kind of two separate camps with the surgeons and then the rehabilitation therapists, and each having their own sort of opinions. But I think as time's gone on, I think people are realizing much more about how important that two mixing together are and how they sort of complement each other so well. And there's only sort of so much perhaps that surgery can achieve, and then rehabilitation can help get more from the surgery. And also there are times when surgery is maybe not the better option, and rehabilitation is a better option for that individual dog and for the family as well. I think for me, one of my big interests is trying to sort of combine the two to try to then maximize outcomes by using surgery in the kind of less invasive ways, and to then maximize the outcome and maximize the function that dogs can get by using rehabilitation as well, to combine with that to really try and get the kind of synergy and best of both worlds together.
Yeah, I think one thing that you can correct me on this, they're quite different speeds as well, in that surgery is quick results. You get in there, you do something, it changes. And rehab is quite slow and it can take a long time. That must be hard for your to be both camps.
Yeah, so that is a really important thing. And I think sometimes for people, they can maybe sort of get a little bit disenchanted by rehabilitation because they're almost expecting a quick fix. And it's not a quick fix. It's something that's going to take time. And it's just, if we were to go to the gym and try to exercise and work out, we're not going to go and have one gym session and suddenly come out looking like Arnold Schwarzenegger. It's going to be something that's going to take a lot of time. If we haven't done any exercise and running before and we try and run a marathon, it's not going to happen. It's something that's going to take weeks, months, years of progress. And I think it's the same thing with, rehabilitation for our canine friends. It's not something that's going to be just one little thing, try it once, and if you don't see a big difference, it means it hasn't worked. It's something that's going to take time. And sometimes that can be a little bit frustrating, and sometimes it can be a little bit slow. But it's something that generally will hopefully get there in the end, and something to keep working towards, and something that will get sort of small improvements along the way. But yeah, it's a different mindset to surgery, particularly sometimes in orthopedics, where we can have a dog that has a broken bone, a broken leg. They can't use the leg. We do surgery, repair the leg, and a day later they're walking again, and it's a quick, sudden fix. So yeah, there are two very different sort of speeds that those things run at.
Yeah, definitely. Okay, so our topic tonight is elbows, and one of the things I wrote in the agenda, I'm organised now, is a summary statement of elbow arthritis without swear words. And the reason I put this is because it is complicated. So just try and summarise what elbow OA kind of is, because it's quite vast, isn't it?
It is huge, yeah. I think it's one of those things where you can love it and hate it at the same time. It is something that's very complex. It's something that we don't fully understand. We don't have a definite answer for, and therefore, sometimes the less that we know about something, the more there is to learn. And that's what makes it very interesting. Things are always kind of progressing and developing. So I think some of the kind of key points or summaries for arthritis in elbows in dogs, or arthritis in any joint, is there are things that can be done, and there's lots of things that can be done. And sometimes people think, well, there's arthritis, we don't have a cure, there's nothing we can do. But that's wrong. There's lots of things that we can do. I made a little list, jot down on a piece of paper, the different treatment options that I offer to clients. And this isn't everything that's available, but it's just what I could come off with, the top of my head whilst I was having a coffee earlier. And I wrote down 63 options.
Oh my God.
63 different treatment options. And we never do just one, it's always a combination. So if you then start to try and do the maths behind it, the different options that we have with these, say, 63, it come out to something like 7 trillion different possible scenarios and options. So if people say, there's nothing that we can do, there's 7 trillion things that we can do. So I think that's kind of one kind of key thing, that it's not, something that we can just say, well, there's nothing we can do, it's the end of the world, or it's, there's nothing that we can do, let's leave it. There's lots that can be done. So I think that's something that's one of the take-home messages. I think the other sort of take-home message is a little bit then maybe the opposite side of things, rather than being quite so positive. It is the fact that there isn't a simple one-off cure. There's not, say, one surgery that we do and that fixes it. There's not one medicine we give and that fixes it. There's not one exercise we do and that fixes it. And it's kind of a combination of things. And I think it's therefore trying to work out for that individual dog and that dog's family, what's going to be the best combination to try and get the biggest improvement we can. I think, with, say, the Olympics going on at the moment, all the sport that's been on the TV, and we can almost think of arthritis as being like elite professional sport in a way, whereby an elite professional athlete, there's not one thing they're going to do that's going to suddenly make them run 100 meters 2 seconds faster. It's all about little incremental gains. And it might be that they can get 1% improvement by doing one extra thing in their training, in their rest, in their technique. And I think it's the same thing with trying to get an improvement with elbow arthritis. It's all about doing lots of little small things together that can have an accumulative effect over time. And I think that's the way that you're going to get the biggest improvement for your canine friend.
I love that. And I do it in a less professional way. I talk about Mabel at the poo bin and how it's quite easy for owners to listen to Mabel, who's by the poo bin, and what she's doing with her dog, and for people to just think that that's the path, when actually there are many, many Mabels, and what works for one dog doesn't mean it's going to work for another dog. And what we try to do with CAM is give people like the smorgasbord of these are all the things that are out there.
Yeah.
Now you need to go and talk to your first opinion vet, maybe seek referral, second opinion, get your support structure, so the multidisciplinary team, and bring together your permutation. And it's going to be different to somebody else's. Yeah. But going back to elbows, why is elbow arthritis particularly difficult? What kind of things? I threw a few things at you, but just running off your head, why would elbows be more complex than other joints?
Yeah, so there's kind of lots of factors that do make it more complicated. And one of the factors is that the elbow joint is made up of 3 bones that all come together, whereas a lot of joints only have 2 bones that come together. So with your hip joint, it's just sort of the ball and socket, but the elbow has these 3 bones that come together. And the condition that we often refer to with elbows, and one of the most common causes of elbow arthritis, is a condition that's often referred to as elbow dysplasia, or we generally try to maybe refer to as developmental elbow disease. And one of the problems with that is that if these 3 bones don't fit together perfectly, that's when you can start to get problems. So it's much more complex for 3 bones to come together, and they move in different ways relative to just 2 bones. Another problem is that it can be sometimes quite hard to spot if your dog does have a problem with their elbow joints, because most dogs, if they have a problem in one elbow, will have a problem in the other elbow as well. And if both elbows are equally as good or equally as bad, because they're equal, dogs tend to look symmetrical as they're walking, and you often don't notice they're lame unless there's a difference and an asymmetry, and then they start to bob to one side with their head. And that can then mean it's easier to spot that there's a problem. So it can mean it can go undiagnosed, unnoticed, and perhaps sometimes it gets put down to, are they just getting a bit older, perhaps, if it's something that develops in later on in age, or if it happens when they're younger, sometimes it might be, oh, they're just no longer a puppy, they're no longer as active. So there can be these lots of little subtle signs, which means if we don't catch it as early, we don't catch these conditions as early, then I think it can be harder to manage things in the longer term. So the more damage there is to the joint, the harder things can become. And we sometimes use this to say this umbrella phrase, elbow dysplasia or developmental elbow disease. And there's not just one type of developmental elbow disease. And you say there's different Mabels, there's also different elbow conditions, and no 2 dogs are the same. So what works for one dog maybe doesn't work for another dog. And the other difficulty that gives us as well as vets is we're trying to do sort of research, and we're trying to get studies to give us evidence, but it's almost impossible to get 2 dogs who are identical. And then if we need to have lots of dogs for a study, it can be really hard to get some good evidence and good data. So there's actually not much evidence in the literature for us. And when I say literature, I mean sort of the scientific studies that are done. It's really hard for us to go and look and say, okay, this is what we should do, because there's just not a huge amount of evidence out there for us. So we need to then try to use what evidence there is, also with what's been working for us, what works for our colleagues, and what we see working for the individual dogs. So it's very difficult, and the cause of the arthritis in most dogs is something that starts early. And what we maybe don't also have is studies that follow dogs throughout their lifetime to know what changes, what's happening when they're young, they're growing, they're developing, what influences that has in later on in life. So it's something whereby there's so much that we do know, but also so much that we don't know. I think the more sometimes I feel that I read and I learn, it just kind of opens up more boxes, that there's more that we still need to know, and we don't have a kind of a perfect solution yet, but it's really, really a complex condition.
Yeah, it's really hard. And people say to me, aren't you bored of arthritis yet? And I'm like, no, because I still don't think I know anything. Because as you say, you start learning something more, and you're like, oh my God, that's just completely opened up a can of worms. There's so many more things we can do. And my my thing was the discovering the complementary, the rehab, the more conservative but exercise focused, massage, acupuncture, bringing all those in. I was like, oh my God, that's just obscene amount of more things that we can add into our little cooking pot. So yeah, absolutely. Somebody says exactly what you were just saying. Somewhere, any elbow not formed properly is umbrellaed under elbow dysplasia. Is that a fair description? If so, will any elbow dysplasia patient get arthritis at some point? What do you feel about that statement?
So I guess technically on, let's say, a scientific level, any dog that has elbow dysplasia, which generally means the joint doesn't fit together perfectly, and that fitting together can be in various different ways. But once you have anything that's wrong in a joint, that then causes inflammation, and this sort of inflammation is what then starts arthritis or osteoarthritis. So I guess technically, if you were to take a biopsy from an elbow of a dog that has elbow dysplasia, you would find evidence of changes within that joint that you could say are consistent with arthritis. So the answer to the question could be yes. However, it can vary, and you, again, I'm sure if we took a biopsy from some of our joints, we might find that there's changes there, but we don't know there's any changes. It's something that's not actually bothering us. It doesn't cause us any pain. It doesn't affect us. So it might be really mild, subtle, or we might call subclinical. So we don't know it's there yet. It's not causing any problems. So some dogs may be in that category whereby it seems as if they don't have arthritis because it's just not bad enough yet to affect them and bother them. But on the kind of nitty-gritty detail, yes, generally any dog that does have a developmental problem, or generally any problem with the joint, will technically have arthritis. And the difficulty is being able to predict the future and know which dogs will have a problem that really affects their lifestyle and their quality of life, and which dogs seem to cope very well. And that's one of the difficulties without a crystal ball to see the future.
No, absolutely. And I think that's quite hard to get your head around at times, isn't it? Because I know I've had, say, a Springer Spaniel that comes in and their elbows are out there and they're walking like this, but they're as happy as Larry. Life's still great.
Yeah.
And they've got no range of motion. It's like peg legs. But then you'll have maybe a golden retriever or something, and they've got very mild macroscopic changes, but that is stupidly painful. And we've got behavioral changes, we've got posture changes, gait changes, and it is a really big problem. So going back to this not being boring, how could it ever be boring? Because there's so many presentations, aren't there?
Yeah.
And trying to choose a treatment plan to suit each one is tough. We've got another question that follows on the same line, which I think is great, and it was where we were heading anyway. Elbow dysplasia, developmental disease, providing no accident has occurred. How much is down to genetics? What is down to environmental? Elbow scoring, both parents say naught on each side. How often do you see offspring with elbow dysplasia?
Yeah, so in terms of an underlying cause, we often use the phrase multifactorial, meaning there's lots of things that are contributing. And genetics is a big component, and probably one of the biggest things is genetics. There are some, I suppose, lifestyle factors that can influence and maybe increase the risk of getting more severe arthritis. But a lot of it comes down to genetics. So there is the sort of elbow scoring scheme. With the aim of that scheme, for people who aren't aware, is that dogs who are going to be bred from have an X-ray taken of their elbow, and the X-ray is scored to look for changes of abnormalities that could be consistent with elbow disease. And you then get a number and a score. And what you're aiming for really is to have a 0. That would be perfect. And for dogs who do have a 0 score, it's less likely that their offspring will have problems, but unfortunately it's not a guarantee. Generally X-rays are only so sensitive, so it might mean that there is changes there, but it's just so mild, it's just not possible to pick it up quite yet. So it's uncommon, but no, I have seen dogs who their parents have had a perfect 0 score, but yet that dog does have elbow dysplasia. So it is possible. But if you were looking to get a dog, then it is a good idea that if the parents have been scored, then it reduces the chances of your then new dog having elbow dysplasia and it being sort of passed on from generation to generation.
Yeah, and looking at what breeds it's more prevalent in, and admiring Duncan Lascelles' work, you know, and him and his amazing team with the whole Coast, which is like the first tool that actually has stage 1, which is it could get arthritis. Hasn't necessarily got it, but could, because it's a breed predilection, you know. And I think that's really interesting. People don't think about it when they're choosing their breed of dog, what they're going to have for the next 12 to 15 years is maybe I should just delve in what they're really predisposed to. So pugs, guys, really bad hip dysplasia, you know, the heart is not high. The wobble, you know, the pug wobble. Well, actually, I think something's going on. So having to think about the breed. But what do you think about lifestyle and exercise? And the reason I say it's quite poignant for me at the moment because I'm looking after my friend's 7-month-old little spaniel down here who's actually been amazingly quiet. And if I was to follow the rules and regulations, I should be doing something like 35 minutes twice a day. And we've been in Cornwall, and she's been having free exercise on the beach with the other dog, impacted sand. And I've kind of let her have a little bit more play than the 35 minutes twice a day. I've checked her on a regular basis. There's no problems. Yeah, I've checked.
Yeah.
So I'm quite confident with that because I'm thinking she's learning lots of other skills. She's learning balance, agility, power. She's socializing. She's experiencing the world. What's your thoughts on exercise's impact on joint disease in particular?
Yeah, so I think that exercise can have an impact, but I think it's not quite the impact that many people think. And the reason I say that is there is, as you say, often this thought that we should only let growing dogs exercise a certain number of minutes, and this specific number of minutes. And it gets sort of passed on and passed on. And again, if you try and look at actually for the evidence behind it, there is very little evidence to say that, you know, we should only do this specific number of minutes. And you kind of then think, okay, well, let's maybe think about other species, and maybe we think about our own children. So I think about my 3-year-old son. After he's been running around for 5 minutes in the garden, I don't stop him, make him sit in his bed for the rest of the day. We let them carry on exercising and running around. And you look at animals in the wild. So, you know, if we look at, say, a wolf, you know, they don't stop the pups from running around and make them sit still after they've been moving for 5-10 minutes. And it's very uncommon for those dogs to develop developmental, you know, elbow conditions or orthopedic problems. So why is it just for the domestic dog? Why do they only allowed to exercise a certain number of minutes? So I think the kind of key thing is, I think it's very difficult to over-exercise a dog. And I think that people get too concerned about over-exercising. And I think probably lots of dogs are under-exercised. So in terms of not over-exercising them, I think really what that means is if you took a similar scenario with our children. So with my 3-year-old son, I wouldn't go out and try and run a half marathon and have him run along with me. So I wouldn't kind of force him to do a long distance running. I wouldn't get him to try and lift weights. So I wouldn't do anything really intensive, but sort of natural exercise, natural movement that they want to do, then I think that's a good thing. I think that's fine. And as I say, it's kind of good for their development in many other ways as well, to kind of explore the world and to move around. So I think if they are happily exercising themselves, I think they can probably do more than these set number of minutes. But what I wouldn't do is say go, you know, running and, you know, having the dog run along with you, or if you're cycling on the bike, having them run alongside the bike and do long distances in that way. But if they're just playing with other dogs or playing in the park, then yeah, I think you can do more than these certain minutes that are kind of linked to their age of growth.
Perfect, which is great, because there was a long question here from somebody that's obviously got massive concerns that they may have been the person that caused the problems. And I think I'd like to say, from having a skim read of this, it's very unlikely that you were the culprit, guys. You know, I will put an outrageous statement in here. I think what we do with our dogs is quite interesting. And I've got a real pet hate for ball chuckers. And I recently, in the last year, found that they do puppy ones. And they're light pink or light blue, and they're just a little bit shorter. And that's okay, because they're now designed for puppies. And that, no, to me, in that I think it's common sense. If you're doing that kind of impact forces on a repetitive nature, that's when you could potentially have difficulty. So it's the nature of the exercise, not necessarily the quotient. What do you think about that? You're welcome to completely disagree with me.
Yeah. So again, I guess with those ball chuckers, the problem that they do is they allow you to throw the ball much further than you probably naturally could. And what that means is when the dog arrives at the ball, they go to grab it with their mouth and they suddenly put the brakes on, which loads their front legs. And it's a sudden impact from high speed to almost an instant stop. So for their joints, it's almost like a car crash. It's this huge speed and then a sudden impact. So if you're doing that repetitively, then yes, that is going to predispose the joints to being damaged because you're essentially overloading the cartilage and overloading the soft tissues around the joint. So that could cause you some problems. So I think we do need to be quite careful with those ball chucking devices and the ball throwers. And I think that I would probably think of them, if you were thinking of getting a ball thrower, is to think of it in a different way. Think of it rather than to allow the dog to run further and faster. Use it more as something to help you. So if you have a back problem and it's hard for you to bend down and then pick the ball up, then yes, get one to help yourself. If you have a shoulder problem and therefore you can just flick the wrist and the ball will still go a fair distance, then get one for that reason. But to get one to launch the ball all the way across to the other side of the field, I would avoid doing that.
Good, cool. And it's the same whether it's a gun. I saw one of these recently. Have you seen them? They're now like gun tennis ball throwers. I'm like, what are we doing? But anyway, no, that's cool. And I think another thing that I see a lot of people do, which is just because I go to lots of people's houses, and I have done in the past with a mobile service, is when you see dogs doing the death loop around the house and they're on and off sofas, up and down stairs, on and off everything, and they're diving onto our love of laminate floors. We love our laminate and our wood and our tiles. And I think people, when they think about exercise, they only see what's maybe on the leash in the park, and they fail to recognize what their dog is doing inside the home and in the garden. And I've seen lots, like this brown cannonball that I have at my feet. When she goes, she's just everywhere. And I've seen her flying and landing and skidding, and the back legs are going over the front legs. So again, when I talk to people, I'm like, try and open your mind. All of that is encompassed in exercise. If you're cutting back on ball flinging and thinking about rolling the ball and hiding the ball, also think about the activities you're doing in the home. Same page?
Yeah, absolutely. Yeah. I think from a surgeon perspective, I tell people, okay, you have to keep the dog on the lead whilst they're exercising as they're initially recovering. And they think that just means when they go for a walk to the park and don't think about perhaps in the garden or from room to room in the house, that it's still exercise, they're still moving, just in a different location. So exercise doesn't mean just necessarily in the park, it means in the garden, in the house, in and out of the car, all of those other aspects.
Yeah, cool. Okay, so now we're going to move on to more of like the diagnostic-y side of things, because I can remember it was actually a Fitzpatrick thing. I can't remember which one it was, but I was from a very standard first opinion, so radiography, but I hadn't really gone into the realms of CT and MRI. I was like, oh my God, we're using that for elbows. And it was mind-blowing, the degree of diagnostic imaging that you guys do to get the answer of what permutation of disease do we have, so what are our options. So can you just run through with the followers how difficult a diagnostic workup could be, and just kind of stage what you're doing, owner observation, clinical examination, blah, blah, blah.
Yeah, absolutely. So it's a step-by-step, and I think, I'm sure it's been mentioned before many times, a key thing with arthritis or elbow arthritis is in dogs, there's usually something underlying that causes the arthritis or the osteoarthritis. Mm-hmm. So what we can do is to try to find out what the underlying cause is, because that might influence our treatment options or might influence our prognosis. So in terms of getting a diagnosis of arthritis, osteoarthritis in the elbow joint, then there's kind of different steps to the process. And the first step is often a history, which means asking questions about what you're noticing with your dog at home. And that can give us a lot of information, and there'll be, again, certain things that pet families will mention that happen to their dog, and there'll be certain things about that breed of dog, that age of dog, that'll give things away. So this will start to point us in a direction. And then the next thing that we want to do is a physical examination, so that we can have a feel of the joints, the different aspects of the limbs, and sometimes from that, you can be very confident, yes, there's likely to be arthritis within that joint. And so you might be able to make, a very close diagnosis from just that. But that won't usually tell you what that underlying cause is. So often the next step would be radiographs, or which are also more commonly known as X-rays. And X-rays are actually great in the fact that they can be taken very simply, and they can actually give us a lot of information for lots of conditions. But with the elbow joint, X-rays are a bit more difficult because we have these three bones all coming together. So there's always one bone in the way of the other. And with the developmental elbow disease conditions, there's usually, particularly early on, very small changes. And sometimes those small changes can be harder to spot on an X-ray. And with the X-ray, we're often looking at different shades of grey, and we can say, is that a bit whiter than it should be, a bit darker than it should be? You might hear vets or people talk about shadows. They're essentially looking at the different levels of kind of greyness. And what often that is telling us is there more pressure in certain areas? And the word is sclerosis. So is the density of the bone changing? So that can be something that can give us a bit of a clue. And when we have arthritis, what tends to happen is we have these new little bits of bone that form around the joint, and they're called osteophytes. And again, we can see those on an X-ray. So all these little things can help point us in the direction, but perhaps doesn't tell us what the exact underlying cause is. So we can get really now specific in terms of knowing what's the underlying cause. And that's where these more advanced imaging modalities are able to help us. And for elbows, the one that we tend to use the most is CT scan. We can do an MRI as well, but we tend to get an awful lot of information from CT. What the CT allows us to do is to look at the bone in much more detail, and we can effectively take one bone away so that we can unravel the elbow joint and look at individual small pieces.
Wow.
So that's really helpful. So
that's
one of
really
the things
helpful.
we're often looking for is just a little small, perhaps fragment of bone, and that little fragment of bone can be hidden away where we can then manipulate the image that we have just to see certain areas. And in terms of the joint not fitting together perfectly, we can again see, well, where does it not fit together perfectly? And in some dogs, we can see quite clearly that perhaps one bone is the wrong length compared to another bone. But in the majority of dogs, it's really subtle. And it's actually something that we really can't always see, how things don't fit together perfectly on some scans, because the CT scan is kind of a static image. But it might be as the elbow joint is moving in different ways, different pressures, that's when things don't fit together so well. So we can get a huge amount of information from the CT, but it still doesn't give us everything. But it can usually break it down into what type of developmental elbow disease is present. Now, we normally have sort of 3 or 4 different types that we tend to refer to, and it can help to kind of pinpoint which one we're being affected by. And then with CT, one of the limits is it shows us the bone really well. But one of the things that we're really interested in is the cartilage. That's the really important part, or one of the really important parts inside the joint. And the cartilage is the sort of lining on the bone that allows the joint to move smoothly. So often our next step, if we want to assess the cartilage, is to then place a little small camera, so an arthroscope, inside the joint. And that allows us to then magnify the inside of the joint, and we can see in much more detail what's happening to that cartilage. And it's the kind of the pattern of wear and the severity of wear that can influence some of the treatment options that we have. So for me, that's usually the sort of diagnostic steps that we tend to take, starting off with the kind of least invasive, and then sort of gradually working our way up depending on what's needed for that individual patient and what works best for that family as well. It might be that we can be confident on the route that we're going down and potentially skip a step or two if that's more helpful. But that would be kind of the route that would give us the most information.
Yeah. So a take home is it can be really extensive. And if somebody's had a dog with arthritis in the last 10 years, coming to the vet and them now suggesting X-rays leading to CT, maybe even MRI, arthroscopy, that owner's going to be, wait a minute, we just took an X-ray 10 years ago.
Yeah,
but we've really progressed, haven't we? Because our treatment options have dramatically changed. So unfortunately with that does come bills, guys. So if you're having that kind of workup, it is going to be more costly and it is going to take more time. But we had a lovely Facebook Live with David Levine and Dr. Peck from over in Chatawanga. I can't say that. And he was teaching the followers a very basic orthopedic exam. And he was talking about how he's just looking to see if there's any resistance in that elbow, and that will flag up to him. So if he's got a dog and he's just kind of, the dog's chilled, he's chilled, and he flexes the elbow, and there's a bit of resistance there, and he gets a bit of a white eye, he gets a little bit of turn, maybe a lip smack, he's like, I'm going to go and check that out. So it's even the basic kind of free interventions can still give you information, can't it?
Yeah, absolutely. Yeah. So our hands are sometimes our best diagnostic tools, but yeah, things have definitely progressed a long way in the last 20, 10, 5 years, whereby we're able to use technology that's giving us much better answers, which is allowing us to give much better treatments.
Yeah, definitely. And it has to be said, I'm going to give you your due, Fitzpatrick's really led on that. Fitzpatrick is referred to a lot when it comes to elbows. Okay, so now we've kind of diagnosed that we've got some form of developmental disease that has led to OA. And so we've got a arthritic joint. I think it's fair to just kind of touch that there are quite a lot of surgical options out there. I don't want to get caught into this trap because it is tough mustard. But could you divide them into like a young dog, very, very early onset, to older dog, and just throw out there that there are potentially surgical options?
Yeah, so there are different surgical options, and as I say, the surgeries, we kind of put them into, I suppose, different categories in what they're trying to achieve. So in terms of developmental elbow disease, the way I often describe it to people is it's where these bones aren't fitting together properly and they're starting to rub in certain ways. It's a bit like having a pair of shoes that don't quite fit. So if you had a pair of shoes that didn't quite fit and they were rubbing on your foot, there's a few things that you could try to do. And perhaps if they'd also rubbed on your foot and a little piece of the shoe had broken away inside your foot, almost like having a little stone in there. So if that was causing you to be uncomfortable as you were walking, one of the surgeries might be to take that little broken piece, that little stone out. So that's one of the options which we can do via a keyhole approach, so a very minimally invasive procedure. But if that shoe was really rubbing on your foot and you had a big blister on your toe, really sore area, taking out that little fragment's going to maybe make things a bit better, but it's not going to solve the problem. You've still got this big blister on your foot from where your shoe is rubbing. So if you have a young dog or even an older dog, there are surgeries we can do to try and take the pressure off that area. And there's a range of different surgeries that try to change the shape of the joint or change the way that the joint fits together or it moves together. And some of those can be other keyhole procedures. So there's a procedure where we can release a little tendon in the joint. So back to the shoe analogy, that would be like loosening the laces on your shoe to try and reduce some pressure. If you have an area that's been rubbed away and the cartilage is sort of partially worn down, but there's still some cartilage there, there are surgeries we can do whereby we try and shift weight off that area, take some of the pressure off. But if the cartilage is completely worn down, then there are surgeries we can do where we try and resurface that area, where we put something artificial. So rather than bone and bone, we have sort of plastic and metal that can then glide against each other. And worst case scenario, if all of the cartilage is lost, there are surgeries where you can try to replace the whole joint, or if the joint's painful as moving, you can fuse it. But those surgeries, in terms of an elbow replacement or an elbow fusion, they're really sort of last resort. I very rarely ever recommend those to people. Whereas the other surgeries, what we really want to do is try and do the least aggressive, least invasive surgery. So we try and kind of tie it to what's going on in the joint, but also to the dog as well, their age, their lifestyle, and what's going to work for the family. So that's one of the reasons why it's really complex, is there's not a sort of black or white, this is the instructions we follow. There's so much that kind of goes into it. But yes, there are surgeries that can help. But what those surgeries tend not to do is they don't cure the problem.
No.
So they don't kind of cure the arthritis. They might be able to maybe slow the progress down. And with this condition, we've also got sort of two factors. We've got the mechanical factor, which is what surgery can adjust, But then we've got this inflammation that's going on in the joint, and that's what surgery can't necessarily cure or resolve. So this is where we need to use a combination of therapies, so surgery, medicine, and then our rehabilitation, our lifestyle modifications, all of these things trying to work together to kind of get a holistic approach to try and get the biggest improvement.
Cool. Okay. So I think now that we're going to go into what I put in our letter in bold in our last like 20 minutes, which is much more of the rehabilitative approach, because this is what is going to apply to the vast majority of followers. So let's just go for a Labrador, 4 years old, bilateral. We've got some gross remodeling already. So we've got loss of range of motion, and the dog is, you can see, uncomfortable. So we've got a short, choppy gait. We've got some weight shifting back. We've got some postural changes. We've got some kyphosis where they're bringing their back legs underneath them because they're just like hot coaling the front. What kind of things would be in your toolbox that you would be thinking, right, you know, and they're not going to ever be able to afford surgery. So they haven't got the finances to do CT, and because that's not going to be an option for them. Yeah. What kind of things are in your toolbox in that situation?
Yeah, so I think that there's so many things that we can do. I think some of the things that come to mind straight away are weight management is a big thing. It's a topic that people often don't like to talk about, but weight management is really important. So if you have a dog that is overweight, then if they're able to lose some weight, that is going to be something that you can do at home relatively easily, and it will have a big difference. And it's interesting because the being overweight isn't just that the fact that they're heavier and there's more force on the joints, but what's super interesting is that the fat cells are able to release chemicals that can travel through your body and actually make the inflammation of arthritis worse. So there's this kind of double-edged sword to it. So weight management is kind of a key thing. And that's something that, you know, everybody should be able to help their dog with. And that might either be cutting down the amount they're being fed, particularly with sort of tidbits, or it might be trying to use a diet that's perhaps sort of lower calorie, but that would be something to start. And again, this is going to be something that's going to be gradual. You don't want to crash diet. You want to kind of do it gradually over time, but that would be one thing that can help. Other factors then would be looking for scenarios that seem to exacerbate the problem. So if the dog is going and on a Saturday going for a really, really long walk up through the hills, and then Sunday is just completely flat out of sleep, really struggling, and it's done too much that day, then try to avoid the sort of sudden changes in exercise. Try and keep things gentle and consistent. And if there is anything that seems to exacerbate it, then try to avoid those factors. And what might be really useful is to keep a little diary or a little log, so you can actually then know what seems to be making things worse. And then the other factors we can add in are other aspects of rehabilitation. So things like, say, physiotherapy and hydrotherapy. And actually both of those together. So I think some people tend to think, is it one or the other, or do they mean the same thing? But they're sort of two different things, and they're sort of complementary to each other. So with physiotherapy, again, this can be things that you can go and see a physiotherapist, a veterinary physiotherapist, or a vet who's interested and has knowledge in this, and they can give you some exercises that you can do at home. And that's going to be the key thing, is sort of a home exercise plan. And what the physiotherapy will be aiming to do will be to try to improve comfort. So it might be some massage techniques to try and take away some tension in the muscles that are having to work extra hard to try to hold these joints in a certain position. And what can happen is that if the elbows don't want to move as much, the dog doesn't want to move their elbows as much, then they might be getting their shoulders muscles becoming affected, parts of their trunk becoming affected. So this is why when you describe the dog, they might have these other changes going on through their posture. So that can be a really sort of helpful thing for them as well. And hydrotherapy can be a way that if they're struggling to do exercise by running around, then it can be a way for them to do it where there's less pressure on their joints, so it's lower impact. And from doing hydrotherapy sessions, you can get improvements in range of motion of joints.
Well, that is a really good, there's a question about that. Do you have a preferred hydrotherapy modality you refer elbow dysplasia to? I was remembering that, lady. I didn't forget, Danielle.
Yeah, so I think it depends on how affected the dog is. And what I mean by that is essentially we're trying to get the dogs to be able to walk, to be able to run. So something like an underwater treadmill gets them walking and running and using the muscles that would be used for that type of motion. So I tend to, as a general rule, have a stronger preference for the sort of underwater treadmill for lots of conditions. But I think that being in the pool and swimming can also be a way then to completely unload the joints and get them moving in a different way. So for dogs who are really struggling even to do a short walk and we find the treadmill hard, then it might be that swimming in the pool can be helpful. And to be honest, probably actually complementary in doing both. And for some dogs, they actually respond better to one than the other. So for some dogs just stand still in the treadmill and don't walk. For other dogs, they go in the pool and they just kind of float around. So it depends on which one's actually getting them to work. So it might be a bit of trial and error. Again, if you just go and do one session and you don't suddenly see a dramatic difference, well, that's to be expected. But something to kind of do over time and do sort of multiple sessions.
I have to give someone a shout out, actually. She's incredible. She's called Jane and she runs, I think it's called 1-to-1 hydrotherapy down near Chichester. And she has a combination of a hot spa bath plus the underwater treadmill plus the pool. So the dogs will do the full spectrum. So she gets the best of all. It's amazing. It really, really, hats off to Jane. And there was studies showing that swimming increased the range of motion in the elbows, and it didn't in the hind legs. So as you say, you can have a combination, but it's what suits the dog. I've got a good question here because it always comes up. Well done, Fergie. What about the shoulder? And I think this is quite pertinent because we were talking about compensation and postural changes and how there's pain elsewhere. Can you explain to people, because people are like, no, but the last vet said just elbows and now you're saying there's something else. What's all that about?
Yeah, so essentially our bodies, every part is connected and linked, and some things are more linked in obvious ways, and an obvious one is the elbow and the shoulder. So if you have something affecting one joint, and that joint is painful, so you have arthritis in the elbow, the dog will maybe not want to move that joint as much, and therefore they still need to move their leg enough to be able to walk. So what they'll do is rely more on their other joints. And typically then the muscles around those other joints will be working harder than normal, and there'll be more loads going through those joints than normal, or those joints, they're going through a larger range of motion than normal. So you can start to get some soreness in those joints. And again, be very similar to us, everybody who's now sort of sat at home. I imagine you're a bit like me, you're kind of slouching more and more in your chair as time goes on. And then your back starts to hurt. And it might not actually be your back that's the problem. It might be muscles down around your legs that aren't sort of strong enough to support yourself. And everything has these kind of knock-on effects. So having a problem in one joint, so having a problem in the elbow, doesn't mean that they're going to then get another disease in another joint. But because that joint isn't functioning as it should, you can then get sort of knock-on effects on other joints. And that's something that I find that kind of rehabilitation therapists pick up on a huge amount. So I think sometimes for surgeons, we can just be focused on what's that one joint that's the problem, but there's much more kind of going on. And therefore, we kind of need to take a bit of a more holistic approach and look at other aspects. So, yes, in terms of the shoulder, it's really common that when we do a CT scan of the elbows, I quite commonly do include the scan of the shoulder as well and other parts of the leg. And it's very common to pick up some changes that are present there.
Yeah, and would you say that by ignoring the associated joints and associated tissue, you may not get the improvement that you expect? So if you've done freaking amazing surgery, like you're like, oh my god, my surgery is amazing, dog's not improving, why is the dog not improving like it should do? It could be that there's a secondary that hasn't been attended to. Is that fair?
Yeah, absolutely. There could be something else that's going on. And I think with the elbow is such a common joint to have a problem with, that if you had a dog, if you're a vet out there and you see a dog and you think, yes, this dog has got a shoulder problem, I'd always kind of recommend checking the elbow as well, because it's such a common joint to have a problem with, and they are linked. There are muscles that cross both joints, so that the biceps muscle goes across the shoulder and across the elbow. So as that muscle moves, it's affecting both joints. So there is a lot that is linked between them.
Cool. Okay, so we've only got we haven't got long left, so I want to take you into the world where we're a little bit let's just do Lynn's question very quickly, and then we'll go into the world a bit more comfortable. Would you only CT if you thought surgery is likely to be needed, because they're quite expensive, and obviously somebody might have limited funds? So if she knows she's never going to go down surgery, do you feel CT is still an important component?
I think that it can be, in the fact that it can give us information that can help us to predict maybe a little bit more what might happen or what could happen. So, for example, there are some conditions that make up elbow, or a condition that makes up elbow dysplasia or developmental elbow disease, that's often thought of as part of this, whereby dogs can develop a fissure in their bone. And that fissure can be very hard to spot on a plain X-ray, plain radiograph. It's something called a humeral intracondylar fissure. We tend to generally see it in spaniel breeds. And you have a little spaniel in the room with you. And this fissure can sometimes then lead to bone breaking and fracturing. So if you had a dog that was lame, and it might be that, therefore, rather than thinking they've just got arthritis, you might think, well, maybe there's something that could be a bigger problem that could happen. And it maybe might just mean that you're much more wary about not letting that dog jump from a height, or chasing and getting the ball, and the sudden stop and the sudden impact. So I think that's an important factor. The other thing is that it's uncommon, but sometimes you can get more unusual or more weird and wonderful conditions going on that sometimes might look like arthritis, but they're actually not. So kind of a scary one is that some tumors affecting joints, they can perhaps look like they might on an X-ray look as if they're similar to arthritis, or when you feel the joint, they might feel similar to arthritis, but it might be more something concerning going on. So it's something to still consider, whereby if you're saying, you know, I don't want to have surgery, I think it's still important to take some diagnostics to get a bit more of an idea of what is going on. And it might also then give you a bit of a better idea about what to expect.
Yeah.
So in which case, you know, you might know, yes, this joint is very severely affected. We're not expecting the limp to go away altogether, but we're going to try and get it the best we can. Or it might be that changes are actually mild. You know, yes, we should be able to get a bigger improvement. And if we're not, why is that? Do we need to sort of re-look at things? £4,000 for a CT does sound like quite a lot of money. I guess, you know, have a little think about that. And there might be places you can get it done at a different price. So, yeah.
Yes, good call. Thank you for that. Joe Hales has taken me to the world that I want to drift into for 6-7 minutes before we do the 10 top tips, because that is a completely different approach. And there's wide opinions out there. There's people that are really supportive of intra-articular administrations, and there are people that are still very, very hesitant, that the evidence just isn't strong enough there. Personal opinion, where are you at with it all?
Yeah, so intra-articular injections means a joint, an injection into the joint itself. So I use these actually quite a lot. And I think, though, that they're not, again, a magic cure. They're not going to solve the problem. They don't kind of cure the arthritis, but they are something to have in our arsenal, have in our toolbox of things that can get an improvement. So there's lots of different things that can be injected, and they sort of work in different ways. And whenever you have lots of different options, often it means that there's not one perfect solution. So we can try to use some medicines, some options for injection in some dogs that might use different in other dogs, based on perhaps what's going on in that joint, based on the symptoms, based on their age. So there are different things that we can use. And some of them can be essentially like a drug, so like a steroid type injection, often referred to as a cortisone injection. So there are some options. The fluid that's in the joint is the lubricant, and arthritic fluid doesn't lubricate quite so well, so we can put in essentially lubricant replacements. Or we can also use things that are often referred to as regenerative medicine. So this is taking something from the body and then placing it into the joint to try to help the body heal itself. So I think that injections into the joint can be really helpful. It means that they're not, I say, the kind of perfect solution, but I think they can be helpful for lots of dogs. But it is very variable. And I have some dogs where we do the injection and people come back and say they see no difference. Whereas we have some and they say, yes, there has been some improvements. So it varies. And the difficulty is we don't have a way of predicting which dogs respond well to some forms of injections and which ones respond better to others, which ones don't respond at all. And although it's low risk, anything that's, say, going into the body, into the joint, there is a risk involved. And to be able to safely place the injection into the joints and make it comfortable, we do need to give dogs a sedation. So that is another little downside as well. So if they have any underlying health conditions that would kind of mean that having a sedation is not a good idea, then it might mean, again, these injections aren't the kind of perfect option for that individual.
And as you say, we don't know how often some of them need to be repeated.
Yeah.
So, and that's a drawn out process. So of repeated expenses. Where are you at with shockwave therapy?
Yeah, so shockwave therapy, I tend not to use it an awful lot for arthritis, to be honest. I use it more for other conditions, but for arthritis, particularly with the elbow joint, it's something that I tend not to use an awful lot of. Again, with lots of these sort of modalities, there is some limited evidence in sort of scientific evidence as to how well they work or how they work. So I do use shockwave for some conditions, but I tend not to use it an awful lot for arthritis.
And that's again across the board. There's people doing different things. So Kiki Hausler and Matthew Allen, they're doing quite a lot of shockwave. Cambridge in Germany, and there's people are doing different things, and I think it just really shows there isn't the one fix. There is many different approaches to a big problem. Just finishing with your regen, Fergie's put back. I like Fergie. Fergie's good questions. Would you consider regen med as an early or a last resort after surgery?
Yes, that's a really good question, and I think the answer is would consider it for both. I think that a lot of the time when we do use these regenerative medicine techniques, we're using them in joints that are end stage, they're really bad joints, and there's only so much anything is going to do for these joints. I think it does become interesting to think about using it at an early stage. Again, we don't really have evidence to say if we do give it at an early stage in the disease process, will it slow the progression down, will the severity not be as bad? But it's something that's very interesting, and it's something that I would consider using in the earlier stages of the disease process. But it's all a bit of an unknown, really, so it's hard to make a really sort of strong evidence-based decision to advise people to do it. But it's something that I will have a little discussion about with people and offer it as an option. So it's an option that we can do. Try to give everybody all of the options, and then we can work out what's going to be the best for them. And but it's something that's interesting, and I think that as time goes on in the next 10-20 years, we will learn a lot more about, so I'm sure we'll have some more answers in time.
Yeah, and I think from a vet perspective, it can be quite difficult when you've got a case that, say, it's early and the signs are reasonably subtle, and you put in an intra-articular and it does profound change, but because the signs were subtle, the improvement's subtle. But then you can have a really end stage joint where the signs are seriously bad, and that injection makes a minor amount of difference, but profound clinical improvement. And you're like, what's the best option? What about just the last other things like laser, PMF? You've got a number of like the photo, not biomodulation, phototherapy. So stay away. They've got laser and they've got phototherapy, massage, acupuncture. Where do you go with all that?
Yeah, so I think this thing comes down to, again, the sort of marginal gains. So I think all of these things are things that can help, but they're not going to sort of essentially solve the problems. And I think it's a case of having that as the mindset, okay, that if we go and do these sessions of laser, we're not going to kind of cure the arthritis, but it might make a small improvement. But it's, I think, knowing how much improvement you're going to get. And I think that's kind of quite an important thing, whereby you might say, okay, we have a certain amount of funds that we can spend on this, and how do we use that money most appropriately? It might be we have a certain amount of time where I can take my dog to a therapist to have this done. What's going to be the best thing to do? So I think, again, they are all things that can help, but they're only going to realistically probably help in a smaller way. But the things that probably aren't going to cause things to be worse. But I suppose what I wouldn't want to maybe have happen is, a dog to have a therapy done for a long time, and maybe not to had any x-rays or scans done that would have then meant the plan would have changed in a completely different direction. You might have spent a lot of time, a lot of funds on something that maybe hasn't given them what they were kind of expecting. So I think it's just a case whereby all these things are things that can help. There's some small evidence behind some of them that they can help in certain conditions, but the amount of evidence again is really sort of small. But I think they are just trying to have these little 1% improvements to help things, and some things might help things by 3%, some 4%, some 1%. We're kind of making these sort of numbers up, but they're all little things that can help.
And I think something that needs to come alongside them, and CAM and the CAM ambassadors and the CAM followers are getting more and more, they're getting better at, is objective assessment and going, well, I've gone down this path and I've tried laser and I've done a session twice a week for 6 sessions, and do I feel it's made a difference before spending on another 6 sessions? So I think something that I hope that CAM will do for people is giving them the power, the empowerment and the education to guide their pathway, rather than going, well, I'll just try it, see what happens. So yes, guys, stick with us, because that's what we intend to do. We smorgasbord of all these options, but also the ability to navigate through them, choosing what does work for you. You're amazing. Okay, we have got no time, but can we do 10 top tips quick fire? Because we have given them so much information that we now need to give them just some simple take homes. So I'm going to start with number 10. And I'm going to do the one that you've already said. Weight loss. Guys, just get on with it. It's profound, the impact that it can have. Number 9 for you.
I would say think about, why is there arthritis? So is there something underlying that's causing it? And perhaps managing that underlying problem could help with the arthritis as well, rather than just saying it's arthritis.
Love it. My old favorite is look at flooring, guys. More rugs, less drugs. Is there evidence out there? Probably not. No, there really isn't. But there's a lot of common sense behind it. If you've got unstable, weak, inflamed joints, if they're being bent this way, that, and the other, with slips, trips, and falls, you're not going to be doing them any favors. So look at the flooring in your house and get something tractional down. Number 7.
I would say intervene early, and that intervention could be adjusting the flooring or adjusting things at home. But if there is something that's not quite right, maybe don't wait for it to get really severe. Start to put some of these lifestyle changes into process early on.
Yeah, definitely. Number 5, I've not said this one before. Get a team around you of your family and friends. We actually have had a number of people come to Holly's Army and they feel very, very lonely, because they're trying to put all these marginal gains in place, these subtle changes to the dog's lifestyle that can have a big impact. But the rest of the family just aren't on board, and they're still chucking the ball. They're still allowing the dog to jump in and out of the car, etc. So try and spend a bit of time with the surrounding people, bringing them up to speed. And that's why the resources are there. Get them to watch a Facebook Live. Get them to go into Holly's Army. Get them to read the website. So that's number 5. That's number 6. So number 5 for you.
I would say keep a diary. So it can be, again, the process with the disease and the help with treatments can be very subtle and gradual. So keep a little diary, keep a little log, so you can look over time, are we heading in the right direction? And then we can kind of adjust treatments from there.
Perfect. Number 4, find somebody that loves arthritis. Do your best, ask around, in the practice. Don't be scared of saying, is there anybody in this practice that really gets a buzz out of managing chronic cases and chronic pain cases? I was chatting to the lovely Jenny Bowen-Smith from the Small Animal Liverpool Small Animal practice today, and she calls herself the arthritis nerd, and I'm so stealing that. But there could be an arthritis nerd in your practice. There might be a nurse that's the arthritis nerd, but don't be scared to say who in the practice has got a little bit of a penchant for this, because you're going to see them a lot and they're going to throw you lots of ideas. Number 3,
I would say always remember that there is something that can be done to help improve things. It might be a little small thing, it might be only going to get a little improvement, but there's always something that can be done. So try and stay positive, and then try and seek out those extra little things that will help.
Love it. Number 2, Remember that this is a fluctuating disease, guys, and we see people that their world falls apart because their dog's going through a flare and they've not realized that the disease does this. So when the flare happens, they're like, oh, it's done, we're over, end of. Take a breath, speak to your vet. You're probably going through a flare, 10 to 14 days with conservative management. I'm hoping you'll come out the other side. So breathe deep, learn about breakthrough pain and acute flares. Number 1.
Can I say continue to follow Cam?
Yes, you can. Yes, you can. We really love doing what we do. We really love what we're doing. And I have to say thank you to the CAM team, who are incredible. They're vets, nurses, hydrotherapists, specialists. I need to say thank you to the CAM ambassadors, who are an amazing group of owners that give up their time to supervise the platform, the Holly's Army. I want to say thank you to Harmony, who's doing our education centre where our owner courses are and our canine professional courses. Janina, who does our social media. It is a huge team that puts, and Tanya and Craig, who do our web design and help with all of our graphics, our freaking amazing graphics, guys. So yeah, CAM is a massive network of people that give their time for free. So thank you for saying that. That's very, very kind. You're adorable. We like you. You can come back. Thank you, James. You've been brilliant. And everybody's saying thank you. It's an absolute pleasure to host you. So thank you so much for your time. We will be back next week. I can't remember who's coming next week, but it is always amazing. So please look at our events list. We have at least 1 to 2 Facebook Lives a week until the end of the year. So please do support these. Come join the big walk. We have a soundbite from a specialist every single day. We have loads of competitions. We've got ramps, we've got raised bowls, we've got coats, we've got beds. Every day somebody's going to win a prize. So please join the big walk. It's not too late. Till next week, I just need to say thank you again to James. Thank you so much. And we will see you later, guys.